In this video, I'm going to talk about how niching down is actually costing you money. So one of the biggest things that we see a lot of times is that most practice owners come in and they're like, hey, I'm going to be working with pickleball, male, 30-year-old knee patients who only live in these 3 zip codes. And a lot of times we say okay, well, we can do that, but just know that your marketing costs, your CPLs, which is cost per leads, it's all going to be through the roof because you are so niche specific that you're not giving yourself an opportunity to be successful. So one of the things that I like to tell owners a lot of times is we're not going to niche down, we're going to actually niche up. And what that means is that if you look at the 3 big niches in the world, it's going to be health, wealth, and relationships. Now, we're not talking about wealth right now. We're not talking about relationships. We're talking about health. Okay, so inside the health field, and we're not talking about ER or oncology, or we're not talking about neurologists or primary care. We're talking about rehab. Okay, so if you're looking at this thing and you have health and then you bring it down to another subdivision, we're looking at rehab. Now inside of rehab, we have functional medicine, we have chiropractic, we have OT, speech, physical therapy, right? We have physiatrists, we have all this stuff inside of the rehab space. So now all of a sudden I got health, I got rehab, and I got PTs. And now, if you think about it, inside the PT space, and I'm a PT, so that's what I'll use as an example. Now, all of a sudden, we're at physical therapy, and it's just are we at acute care? Are we inpatient rehab? Are we independent living? Are we skilled nursing? What are we doing here? What is the setting? So a lot of us are gonna be private practice ortho, right? So now all of a sudden you go into this thing and now we have our own private practice. Some of you guys might be subleasing or mobile or whatever that looks like. And then what we decide is I wonder who we're going to serve. And then you're okay, well, I'm gonna do women's health. I'm gonna do sports. I'm gonna do orthopedic. I'm gonna do lymphedema. I'm gonna do this. I'm gonna do that, right? So now we're just niching down even further. And then you get to lean in and say you know what? I think I'm gonna just charge people cash, or I think I'm gonna charge people out of network or insurance. Now all of a sudden we sit there and we're okay, so we got healthcare, we got rehab, we got physical therapy, we got outpatient ortho, we got out of network clinic, okay? How much more niche down do we need to get here? So then you lean in and say well, I only wanna work with knee pain, or I only wanna work with shoulder, or I only wanna work with back pain, or I only want to work with TMJ. Okay, well then go ahead and we'll niche into that. And then you start leaning and be well, now I only want to work with knee pain, and I want to work with these 3 zip codes, this age range, and they have to play pickleball. And it's just what are we doing here? So I want you guys to understand that yes, people say that the riches are in the niches, but the further down you go into niche, you're gonna box yourself out of the marketplace. Now, if you guys are gonna be niche specific, and that specific, and you're gonna niche all the way down, you better cost a premium price. Because if you are actually the expert of the one thing that no one has other than you, and there's 10 people in the world that have it, it's just you better, because you specialize in, you better pay a premium price for that, okay? That's your permission to raise your prices if you're that niche down. But most of you guys, what you need to do is okay, health, rehab, we're an outpatient clinic, we're gonna be out of network, whatever this looks like. We like to treat knee pain specifically, maybe a little patellar tendonitis, we do runners, we do whatever. Your marketing, just go up a level. So instead of doing hey, running analysis, just for runners, this age, whatever, just go, hey, just general knee pain. We'll attract the people in who have knee pain, and we could always filter them out. That's when you start to win the game. So I do agree that the riches are in the niches, but if you start to get too niche specific, you're gonna start to box yourself out of the marketplace and actually end up losing money, getting really frustrated, and then you always lean in, and I always say, just go ahead and niche up a little bit. So I appreciate you guys. Hopefully you found value in this video. If you did, go ahead and like and make sure you hit the subscribe button, or follow and subscribe. And then also if you wanna learn more about figuring out hey, maybe I'm not getting the patients I want because I'm a little bit too niched in. If you wanna link up with our team to find out more, feel free to click the link in the description, and I look forward to seeing you guys on the next video.